disease is something that doesn't always come with a warning. In Malaysia, it's one of the top causes of death. And it's not always comes easy to spot the signs until it's too late. Many people live with heart conditions without realizing it, putting themselves at risk for heart attacks, strokes, and other health issues. Welcome to the Gleneagles Podcast. I'm your host 𝗖𝐸 𝗿𝗏, and today we'll be focusing on the common heart conditions among Malaysians. This episode is particularly important because we're talking about the conditions that are most prevalent here in Malaysia, conditions that often go undiagnosed. Joining us is Dr. Neoh Eu Rick, consultant cardiologist here at Gleneagles Hospital Penang. Doctor, thank you for coming. It's great to have you with us today.
Thank you, Nisa, for inviting me to this Gleneagles Healthcast. It's a pleasure and an honor to be able to share some health information with you folks.
All right, sounds great, Doctor. Thank you again for coming.
You're welcome.
So before we dive deeper into today's topic, let me remind you that we'll be announcing the winner of our giveaway quiz at the end of the episode. So stick around to hear if you've won. And don't forget to follow us and leave a comment below because we want to hear from you. Let us know if you have any questions for our experts. Dr. Neoh, diving into the topic, when we talk about heart diseases, what are the most common conditions that Malaysians should be aware of?
Okay, that's a good question, Nisa. To start off with, the most common heart condition is coronary heart disease, or on a broader term, what we call as cardiovascular disease. What happens is there's a gradual blockage of the arteries of the heart, which lead to a heart attack. And the second most common condition is a stroke. If you can get a blockage of your heart, you can also get a blockage of your brain arteries. So essentially, the process is the same. It's a process that we call atherosclerosis. Let me show the audience what I mean by that. So this model shows a longitudinal section of your arteries of the heart. When we are born, we are given quite perfect arteries, but as we age, we smoke, we take unhealthy food, there will be a gradual build-up of a fatty plaque or cholesterol plaque in your arteries. Over time, as the years go by, these plaques increase in size, and when they block the artery of the heart or the brain, then you will get a heart attack.
Wow, Doctor, these sound like very serious conditions. How do these diseases actually impact Malaysians, especially when many people may not even realize that they are actually at risk?
Do you know what is the top killer disease in our country?
I'm afraid I don't, Doctor.
Well, it is cardiovascular disease. Cardiovascular disease, heart attacks, and strokes comprise about 25% of the total death in our country.
Wow, it's actually quite a lot.
It is. Next in line is pneumonia or lung infections. That is about 15%. And we're also worried about cancer, which is a major killer disease. Cancers comprise about 5% of the total mortality in our country. So that's putting into perspective. 1 out of 4 people die of disease in Malaysia, die of a heart attack or a stroke. That's how bad it is.
I see, Doctor. So I guess it's fair to say that these heart conditions are actually much more common than people might think. And that especially when many might not show any signs until it's too late.
Yeah, that's why we need to be proactive. We need to take close attention to our health. As the old saying goes, prevention is always better than cure.
Dr. Neoh, I'd actually like to ask, what are the main risk factors for heart diseases? And are there anything that we commonly see in Malaysia?
Okay, Nisa. There are non-modifiable risk factors and modifiable risk factors. Let's start off the non-modifiable risk factors. This include your age and the sex that you're born in, the gender that you're born in, and your family history. You can help it if that your father had a heart attack when he was 30 years old. The modifiable risk factors include the big 4: high blood pressure, diabetes, high cholesterol, and unhealthy lifestyle and smoking. Unfortunately, in Malaysia, a lot of us have a very unhealthy diet. We eat too much fat, we eat too much carbohydrates, and we have an unhealthy lifestyle, an unhealthy sedentary lifestyle, or being a couch potato.
I see. Thank you for explaining. To dive more into the topic, do you know any warning signs people should be watching out for? And is it possible to be at risk even if you feel completely fine, like there's nothing wrong with you?
Okay. Let's go off with the symptoms first of heart disease. The most common symptom that we actually suffer if we have heart disease is the chest pain. A typical chest pain that a patient with heart disease suffers is retrosternal or behind the chest. It typically increases on exertion when you work out, when you climb up the stairs. And also if you have increasing breathlessness. If, for example, in the past you were able to run 400 to 800 meters without having any problems, but of late you can only run 100, 200 meters and you start getting short of breath. So these are very typical symptoms of heart disease.
I see. Well, for stroke, is it the same symptoms?
Okay, for stroke is a different thing. Stroke occurs, again, I remind you, is a blockage in the blood arteries of your brain. So when there's a blockage of the blood arteries of your brain, you will typically get symptoms on one side of the body. You will get weakness, you get numbness on that side of the body, and sometimes there will be an asymmetry of your face. You can't speak properly, you start slurring in your speech.
I see. Alright, thank you, Doctor, for explaining. So I think these are the signs and symptoms that we should be looking out for and that we should be aware of. Dr. Neoh, earlier you mentioned that lifestyle actually plays a big role in our heart health. What can Malaysians do to actually reduce their risk of developing these heart conditions that you mentioned earlier?
Well, we can do a lot of things. The first thing is we need to lower our risk factors, the ones that I brought up earlier. Let's talk about blood pressure. We need to try to reduce our blood pressure to below 140/90. You can do that by reducing your salt in your diet. But normally you will need to take a lot of medications or blood pressure medications for your hypertension. So again, 140/90. Try to take your blood pressure below 140/90. The next risk factor is diabetes. You have to control your blood sugar. You need to control your cholesterol in the diet. You need to stop smoking. Smoking is always bad. No smoke is good. One cigarette is still one cigarette too many, right? We need to exercise a bit. So what constitutes good exercise? I'm not asking you to run a marathon. You just need to do a bit of light walking, brisk walking, or light jog. 20 minutes or 30 minutes a day for about 3 to 4 days in a week.
I see. I think that goes with the saying that less is more, and that lifestyle actually affects and actually contributes to the risk factors and how easy you can get these heart conditions and whatnot. So, Doctor, what about people who feel healthy, like they are completely fine, they're not showing any signs and symptoms? Should they still go for screenings?
Oh yes, absolutely. Heart diseases can start off slowly and they have no symptoms initially. That's why we call this, the high blood pressure, a silent killer. You wouldn't know that you have high blood pressure until you get it measured. So we need to detect this disease early before you get heart attack or stroke. Our job is to find you early, to treat you early before you get such dreaded complications like a heart attack or a stroke.
I see. Thank you, Doctor. But even after they come for the screening, what will happen if it shows that they actually have ischemic heart disease?
Okay, so when you go for your screening test, okay, what the doctor will do is, doctor will interview you, he'll ask you about your risk factors, and then he might recommend a few tests that he will put you through. A very simple screening test is what we call an exercise stress test. So what this entails is, we will put you out onto a treadmill or a bicycle. We hook you up on an ECG or electrocardiogram, and we get you to run a treadmill. And based on the results of the stress test treadmill, we will see whether you have a likelihood or that you may have heart disease or cardiovascular disease. Now, once we determine that you may have heart disease, we need to confirm it. So, do you know how we confirm it?
I'm not quite sure, but I'm sure our crowd would love to know. How do we confirm it actually, Doctor?
Okay. We confirm this by doing what we call a coronary or heart angiogram. allow me to show you how it's done. Okay, your doctor will typically get access to the artery of your hand. So we puncture the artery of your hand and we put in the tube or catheter into your artery of your hand, and this goes up into your heart, and we take an angiogram or a picture of your heart blood vessels. Let me show you. So this is what a typical angiogram looks like. Once we put in the catheter into your heart, we'll take a picture, and this would show us where is the blockage of your heart.
I see. That looks amazing. I'm sure our crowd would love to see how the stenting looks like.
Yeah, okay. So this is what the process looks like. This is model, and this is an artery with the plug within. So once we determine that the plug is significant, so again, what constitutes a significant plug is where the plug has a blockage of more than 70%. When you have a blockage of your heart artery by more than 70%, it's very likely that you may have symptoms of a heart attack or a chest pain, and this increases the risk of having a heart attack. So once we determine or we confirm that there's a blockage of more than 70%, we will put in a wire all through the hand. Okay, this is not open heart surgery, this is an angiogram. So we put in a wire, and then we put in a balloon in the stent to open up the blockage of the heart artery. So this is what it looks like. This is before we put in the stent, and once the stent is expanded, it sort of flattens out the blockage or the plug to the side of the wall, and you get a nice, clean, big lumen of your heart artery again. So from a bad vessel which is blocked, we put in a stent and the blockage is relieved. And that's how we do it.
That really looks amazing, and I think we have such advanced technological advancements nowadays. And Doctor, thank you so much for the visual. I'm afraid we have come to the end of our Gleneagles Healthcast today. We have gone through our risk factors of where prevention is better than cure, and we've gone through as well the symptoms and the signs. Well, that brings us to the end of today's Gleneagles Healthcast on common heart conditions among Malaysians. Doctor, thank you so much for being here and sharing your knowledge with us.
Thank you, Nisa, for inviting me here. As always, it's an honor to be able to share some information on health. Awareness is essential in this disease. Once you're aware of this disease, then you can take steps to prevent it from happening.
Thank you, Doctor. And we've talked about how these conditions can often go unnoticed and how important it is to pay attention to risk factors and to go for regular screenings, even if you feel completely fine, even if you don't have any symptoms, as Doctor had mentioned earlier. I think a lot of people assume that they only need to worry about heart issues later in life, but clearly that's not the case, right, Doctor?
That's right, absolutely correct, Lisa. It is a common misconception or myth that heart disease and strokes only happen to the elderly. Not anymore. Due to our unhealthy lifestyle, unhealthy diet, heart attacks and strokes also can happen to the younger people. So again, awareness is essential. Once you're aware of it, take steps to reduce your risk factors and to detect the disease early before you get a heart attack or stroke.
Thank you, Doctor. And for those listening, whether you're just starting to think about your heart health or already making changes, it's never too late to take action. And therefore, I think that comes to the end of our healthcast, and where we talked about preventive measures, risk factors, and other important points that we need to look upon in this healthcast. And therefore, before we wrap up, if you've been taking part in our healthcast quiz, keep an eye on the screen. If you see your name, congratulations. Please send us a direct message to claim your prize. However, if you didn't win this time, don't worry, there are more chances to come in the future episodes. And therefore, thanks again for watching the Gleneagles Healthcast. With us today, Dr. Neoh Eu Rick from Gleneagles Hospital Penang. Remember to follow us for more expert tips and conversations on staying healthy. Until next time, take care. Bye-bye.
Bye.